Hello, everyone. Mike Meeback with KTVU Fox 2 out in the San Francisco Bay Area. And right now we are talking about COVID-19 and smoking. The two probably do not go hand in hand. And to join us with this discussion, we are lucky enough to have Dr. Patrice Harris, president of the American Medical Association, as well as Matthew Myers, the president of the Campaign for Tobacco-Free Kids. First and foremost, thank you both for what you do, and thank you for joining us for this topic.
Thanks for
Good to
having
be with you. Yeah,
Well,
and good to be with Matt.
Yeah, no problem. It's a good group here, and out in the Bay Area, we have a wonderful research institution and hospital in UCSF. And I just want to throw this out there because they did a recent study and they looked at 11,000 COVID patients, and there was a near doubling in rate of disease progression for those who smoke currently, and also for those who used to smoke who may have quit. It's just not a pretty picture. And Dr. Harris, I'll kind of just start with you and get your reaction when you hear about that study.
Well, first of all, that is very important data. And at the AMA, we have said from the very beginning, we really need the data and the science and the evidence to drive decisions. And so that is very important data. The more data we have, the better. Let's just say, though, pre-COVID-19, we certainly were amplifying the risk of tobacco and smoking. It is not surprising. This is a respiratory illness, and certainly you're breathing in all kinds of toxins with smoking and vaping. So it's not surprising that we are seeing these numbers and the increased incidence of worse outcomes for those who smoke.
Yeah, Matt, your thoughts as well?
That's exactly right. We have seen this in every good study done across the globe, and that is the incidence of among smokers getting the most serious effects of coronavirus. We have seen it in country after country after country. And if anything, I think the concern is it's even more pronounced in the United States, where this has hit our vulnerable populations so disproportionately.
Matt, yeah, I know you focus a lot on keeping children away from tobacco. Um, as we go through this pandemic, and I know the tobacco industry is not here in this discussion to represent itself, but is it your understanding that that the tobacco industry continues to kind of target the teenagers out there across America?
It's a really sad story. We see the tobacco industry targeting our teenagers, both with their traditional tobacco products and more recently with their flavored e-cigarette products. So we have a youth e-cigarette epidemic. And the COVID crisis makes it more urgent and more immediate, because what it means is that we know that both of those products harm the lungs, weaken your immune system. And both of those conditions contribute to the underlying conditions which have led to such a high level of hospitalization in our country and more deaths in our country than we've seen anywhere else in the world.
What about vulnerable communities, Dr. Harris? Have you seen the tobacco industry or heard reports of the tobacco industry going into those communities continuously here?
Well, certainly we know there is a long history of the tobacco industry targeting the African American community with menthol products. African Americans use a disproportionate share of menthol products, of course, menthol or other flavors. And again, we have to also make the connection to the new flavors of these new vaping and e-cigarette devices. So these flavors make it easier to inhale and so make it more attractive. And so certainly there's a long-term history of targeting African American communities, and we know that smoking increases the risk for high blood pressure. And we also know that if you have high blood pressure or diabetes, you are more susceptible to worse outcomes from COVID. So all of these issues are interrelated and certainly are making the outcomes worse in communities of color.
And Matt, you mentioned earlier, I mean, you talked about the vaping trend pre-pandemic. Was it your understanding that that trend was starting to decline a little bit, or was it just as bad as it was, just a couple of years ago?
Well, we actually have not yet seen a decline. The data doesn't give us that. Through the end of last year, we saw historic rises with it. Unfortunately, the steps the administration took, eliminating some flavored products but not others, probably simply meant the kids moved from one product to another product. Our hope is that if kids understand that by using e-cigarettes, the flavored e-cigarettes that are so attractive, that they're not only risking long-term health effects, but potentially increasing the risk of serious effects of COVID-19, that we will see more kids quit. And candidly, we hope that more kids will encourage their parents to quit smoking cigarettes during this period of time.
Yeah, especially now. Dr. Harris?
Yes, we had made such great progress with teenagers and young adults regarding the reduction of tobacco use, cigarette smoking, and therefore, of course, the consumption of nicotine. And now, again, with the dramatic recent increase in the number of teenagers and young adults who were using these flavored products, we are reversing that progress. And we know that nicotine has serious and negative impact on the growing brain and other, of course, health effects. And so that's why we are all in. Again, we are appropriately focused on COVID-19, but we also have to continue to amplify the adverse health effects of tobacco and nicotine and these vaping products.
I was just jump in and say, COVID-19 highlights the importance of us taking steps to prevent the tobacco companies and the e-cigarette companies from targeting our kids. And when they target, they historically target our most vulnerable populations, our low-income populations, our African-American populations. It's not that these populations make worse choice than everybody else. It's that the tobacco industry has targeted them with images and flavors that makes them more susceptible and puts them at higher risk. And we're seeing the consequences of it right now. The extraordinary disproportionate impact of COVID-19 on our African American and Hispanic communities is really a tragedy.
And Matt, if I could add quickly, because you made a point about choice, and I really want to make sure that we are clear. I know you and I are always clear on that this is not about blaming and shaming, because as I say, in so many issues of health, regarding choice. The choices you make are based on the choices that you have. And so we have to make sure that we elevate the entire context in which health inequities exist.
And I think it's important to note also that, we should be encouraging, maybe you agree or don't, that we need more data being released right now in regards to race, to age, to ethnicity, in regards to who is actually affected with COVID-19.
Absolutely. In fact, the American Medical Association called on HHS, of course that's inclusive of CDC, to collect the data on race and ethnicity. You can't solve a problem until you identify the problem, and we need the data to know what areas to target, specifically around COVID-19. We could do increased testing in those areas that are disproportionately impacted. So we absolutely have to have the data. We do need it by race and ethnicity. We also need it by zip code. And eventually, we will get the data and the more specifics, more data like what we just had from UCSF, so we can really appreciate the full impact of COVID-19.
And my hope is that we'll act on the data this time. It's great to have the data. We absolutely have to have the data. There are things that we know we can do about preventing the tobacco industry from targeting these communities, eliminating the flavored products that have created both the youth e-cigarette epidemic and that appeal to so many young people, African American children as well. We have solutions to these problems. What we have to do is take advantage of what is going on today to motivate our political leaders to work with our communities to protect those communities.
Matt, you said something earlier that caught my ear, and we may not know the answer to this for a few years down the road, but children basically grabbing their parents and shaking them, saying, hey, during this pandemic, you got to look at this. Look at these people being infected who are smokers. The rate of progression of that disease. I wonder if adults actually are going to quit. Obviously thousands of people have died in a pandemic. We never want to see that. But in a strange way, could the pandemic change people's habits down the road and actually make smokers non-smokers?
Well, our hope is just like with the AMA, the Campaign for Tobacco-Free Kids has been trying to reach out to suggest to parents and to kids now that you're together more than you've ever been, probably, this is a good time to have those conversations and support each other to quit. We have put on our website, for example, a list of free resources where people can go for proven evidence-based cessation assistance at tobaccofreekids.org/COVID-19. And others are doing the same thing. So this is an opportunity if we seize it. Our hope is that parents and kids will sit down, will have those conversations. And rather than lecture each other, they will support each other.
Right, right. You know, when I was 13 years old, I started chewing tobacco, and I remember it to this day. The first time I did it, and it was Skoal, and it was mint flavored, and I wound up chewing Kodiak, Copenhagen, you name it, for the next 15 years. But it always went back to that flavor. I remember trying that first pack. In the end, though, I was able to quit. Um, but for all of this to happen, how important is it really to push our lawmakers? Because in the end, Dr. Harris, is that not it's up to the lawmakers really to ban this?
Well, first of all, congratulations on
Thank you.
quitting. It is difficult. And I know as physicians, we talk to our patients about this, but we by no means believe or think that it is easy. And I also want to say children are great parental influencers. Matt can correct me if I'm wrong, but I believe children played a big role in getting their parents to wear seatbelts. But you are right. This is an all-in effort. We need effort at the community level. Of course, we in our organizations can help, but policy is always very helpful, and we do need to make sure that these flavored products are not available to our adolescents and our young adults. And so policy is critical.
And state and local governments across the country should be taking steps to prevent them from targeting inner city communities, low income communities as well. There is an opportunity. We have exposed a real sore point in the United States to make our certain populations far more vulnerable to industry attack. This is an opportunity to say we're going to do something about it.
Yeah,
And
exactly.
Matt, let me just
Go
say
ahead.
that is a critical point. Let's highlight that point. We should not target the people who are smoking. They have an addiction, right? They have
Right.
something that is a health disorder. So we should not target the users. Even if we pass these laws and they are in violation of these laws, we should target others, but not the users.
Well, that's exactly right. And that's the critical point here to understand is that what we're seeing in terms of disproportionate impact is the result of an industry that has targeted these populations for decades and an industry that has used its political power to prevent many of the political leaders in these communities from taking the steps that they would otherwise take. This is an opportunity for us to highlight it and act on it.
All right, Matt Myers, Dr. Patrice Harris, thank you both for the conversation. Just a quick reminder to our viewers, you can watch this interview in its entirety, as well as plenty of other interviews on our 24/7 streaming service, coronavirusnow.com. Dr. Harris, Matt Myers, thank you again. I appreciate it.
Thanks
Thank
for having
you.
me.
Of course.